TAVI, or Transcatheter Aortic Valve Implantation, is a minimally invasive treatment that enables the replacement of a diseased aortic valve without open heart surgery. With this technology, the biological replacement valve is crimped down to the size of a pencil inside a catheter. In most cases, the catheter is introduced into the heart via the femoral artery. Once positioned inside the diseased valve, the prosthesis is expanded using a tiny balloon, or self-expandable design, and locked into place. The catheter is then withdrawn, and the valve starts to work immediately. The advantage of such a procedure is that it's relatively less traumatic for the patient. In some cases, it can be carried out under local anaesthetic, with recovery taking days rather than weeks or months. TAVI is available for high-risk and inoperable patients. The decision on who to treat with TAVI is taken by a heart team, including cardiologists and cardiac surgeons.